Subscribe to our channel, press the bell icon and never miss an update from Latestly.
कल तक के 1,30,000 पेशेंट के सैंपल टेस्ट किए गए, इसमें से 5,734 पॉजिटिव थे अब तक के। पॉजिटिविटी रेट अगर देखेंगे तो इट रेंजेस बिटवीन 3 to 5% इन द लास्ट 1.5 months. It has not increased substantially.
The Indian Council of Medical Research, ICMR, informed on April 9 that the positivity rate for coronavirus ranges between 3 to 5% in the last 1 to 1.5 months and that it has not increased substantially. Dr. Murhekar of ICMR also informed that till April 8, 1,30,000 samples were tested, of which 5,734 samples tested positive. The country currently has 6,412 confirmed cases, with 199 deaths being reported. However, Johns Hopkins University professor Steve Hanke criticized the Modi government over lower COVID-19 testing in India. He warned that if the situation remains the same, then India can easily turn into the next Italy. The JHU professor also informed that the testing in India is lower than even Pakistan. As per the data released by him, India is testing 102 people per million, Pakistan 191 per million, the United States of America is testing 6,336 per million, Hong Kong has performed the best by testing 12,900 people per million. He added that Modi's lockdown doesn't identify who's ill and who's healthy. Meanwhile, ICMR in a statement said that currently the country is testing 18,000 samples for coronavirus per day across 192 government and private laboratories. They also informed that it is gearing to add 200 additional labs for round-the-clock COVID-19 testing and is considering to scale up testing capacity to 1 lakh tests per day. With a view to preparing for the worst-case scenario, ICMR has taken a number of steps towards enhancing the number of labs, machines and test kits required to test suspected cases across the country, ICMR said in a statement. ICMR on April 9 updated its testing strategy for COVID-19 that has now affected more than 6,000 people in the country. As per the revised strategy, asymptomatic, direct and high-risk contacts of a confirmed case should be tested once between days 5 and day 14 of coming in his/her contact. ICMR also brought all symptomatic individuals who have undertaken international travel in the last 14 days under testing protocol. All symptomatic contacts of laboratory confirmed cases will also be tested. The revised strategy will also cover all symptomatic healthcare workers and all patients with severe acute respiratory illness. In hotspots, cluster in large migration gatherings, all symptomatic people will have to be tested within 7 days of illness. After 7 days of illness, the ICMR suggested an antibody test.